What is Analgin? Analgin, also known as Metamizole, is a painkiller and fever reducer used to treat various types like pain, fever, inflammation. The dosage and duration should be as prescribed by your doctor, preferably taken with food or milk to prevent stomach disturbances. Inform your doctor if you have a history of heart disease or stroke. Uses of Analgin. Analgin 500 mg tablet is a painkiller that blocks brain chemical messengers, relieving headaches, migraines, nerve pain, toothaches, sore throats, menstrual pain, arthritis, and muscle aches. It's commonly used and rarely causes adverse effects if taken at the prescribed dose and duration. To maximize benefits, take as prescribed, avoiding excessive dosage or duration to prevent hazards. It's used for chronic or traumatic pain and requires precautions for patients with medical conditions like asthma, lung infections, severe allergies, or hypertension. This medication may interact with other drugs, necessitating medical precautions. Individual responses may vary, so consulting a pain control doctor before use is recommended. Inform your doctor if pregnant or planning pregnancy. Analgin side effects: dizziness, nausea, stomach pain, vomiting, diarrhea, drowsiness, kidney damage, dry mouth, low blood pressure, abdominal pain, pink-colored urine, choking, agranulocytosis, skin rash, itching, headache, difficulty in swallowing, weakness. Common side effects of this drug include vomiting, stomach pain, nausea, diarrhea, dizziness, drowsiness, or visual hallucinations. Long-term use may necessitate regular monitoring of kidney function, liver function, and blood component levels by your doctor to prevent severe complications like stomach bleeding and kidney problems. Tips while taking Analgin. To alleviate pain, inflammation, and fever, Analgin 500 mg tablet is used. Take it with food or milk to reduce stomach pain. Take it as per your doctor's prescribed dosage and length. Severe complications such as stomach bleeding and kidney problems can result from long-term use. If you have a history of heart disease or stroke, tell your doctor. When taking Analgin 500 mg pill, stop drinking alcohol as it can increase the risk of stomach problems. If you are taking this medication for long-term care, your doctor may check your kidney function, liver function, and levels of blood components regularly. Precautions while taking Analgin. Discontinue use of Analgin if allergic to it or any inactive ingredients. Avoid Analgin in patients with bone marrow disorders, agranulocytosis history, anemia, eosinophilia, or related disorders. Analgin is not used for patients with hypotension, asthma, or liver disorders. Not recommended for children under 15 years of age. Alcohol consumption is unsafe with Analgin. Consult a physician before using Analgin during pregnancy or breastfeeding due to potential risks. Analgin may impair driving ability and use caution. Use Analgin with caution in patients with kidney disease. Dose adjustment may be necessary. Not recommended for patients with severe kidney disease. Use Analgin cautiously in patients with liver disease. Dose adjustment may be necessary. Not recommended for patients with serious liver disease. Interactions. Adverse effects can result from the concomitant use of the following drugs: blood thinners, warfarin, acetocumarole, heparin, corticosteroids, dexamethasone, prednisolone, methylprednisolone, fluticasone, sulfonamides, Bactrim, penicillin-like drugs, ampicillin, amoxicillin, amoxiclav, antidiabetic medications, metformin, glibenclamide, glipizide. Injection of anafortin, when used with antacids, may interfere with camelophen absorption. Additionally, caution is advised when using anafortin injection with medications such as cetirizine, diphenhydramine, disopyramide, quinidine, pethidine, amantadine, amitriptyline, doxepin, and phenothiazine, as interactions may occur. Analgin dosage. Administer orally after a meal, 2 to 3 times daily at 250 to 500 mg per dose. The maximum single dose is 1 g, and the daily dose should not exceed 3 g. For infants, a single dose of 5 to 10 mg/kg is recommended. Dosage for children, 50 to 100 mg for 2 to 3 years, 100 to 200 mg for 4 to 5 years, 200 mg for 6 to 7 years, and 250 to 300 mg 2 to 3 times daily for 8 to 14 years. Overdose of analgin. Possible adverse effects include acute agranulocytosis, hemorrhagic syndrome, acute renal and hepatic insufficiency. Signs of toxicity may include hypothermia, hypotension, palpitations, breathlessness, tinnitus, nausea, vomiting, fatigue, drowsiness, delirium, decreased consciousness, and convulsions. Treatment involves inducing vomiting, gastric lavage, saline laxatives, activated charcoal administration, artificial diuresis, blood alkalization, and symptomatic therapy to preserve vital functions. Missed dose. If you miss a dose of Analgin 500 mg tablet, take it as soon as possible. However, if it's almost time for your next dose, skip the missed dose and resume your regular dosing schedule. Do not double the dose. Analgin storage. Hold it in a jar that is airtight. Keep it free from moisture or overt light. Keep it out of children's reach. Analgin expired. An adverse effect from a single dose of expired Analgin is unlikely, but it's best to consult your primary healthcare provider or pharmacist if you feel unwell. Expired medication may be ineffective and should not be used. For chronic conditions requiring regular medication, it's important to maintain contact with your healthcare provider to ensure a fresh supply of non-expired drugs. Safety considerations when using Analgin. Analgin is contraindicated in cases of hypersensitivity and the following conditions: bleeding disorders, G6PD deficiency, hepatic porphyria, oversensitivity, infants weighing less than 3 months or 5 kilograms, lactation, pregnancy. Important information for Analgin use. Tell your doctor about your current list of medicines, counterproducts, e.g., vitamins, herbal supplements, etc., allergies, pre-existing illnesses, and current health problems before using Analgin, e.g., pregnancy, upcoming surgery, etc. Some health conditions may make you more prone to the drug's side effects. Strictly follow the instructions given on the product or as instructed by your doctor. The dose is dependent on the degree of seriousness of your disease. If your condition continues or aggravates, inform your doctor. Mentioned below are relevant therapy points.